Is there something different about Irish people with dementia? It's estimated that there are around 10,000 Irish people with dementia in Britain today. Because of the older age profile of the Irish population in Britain, there is an increased risk of dementia. This older age profile reflects the large numbers of people who emigrated from Ireland in the 1960s and 70s. Those who left Ireland in their late teens or early 20s in the 1960s are now around their 80s and therefore have a higher risk of dementia. But there are also other factors which increase the risk of getting dementia. Although it's not always recognised by professionals or policy makers, Irish people have high levels of high blood pressure, stroke, heart disease, and all these predispose people to vascular dementia. But one of the most significant factors for the Irish community is social isolation. And this is associated with a number of social and health factors. Irish people have high levels of long-term illness, which limits their ability to get out and about and to be sociable. They also experience high levels of anxiety and depression, and that has a similar impact on their ability to get out. They're also much more likely to be living alone, having been widowed, divorced, or never having married. So social isolation is a multifaceted risk factor for Irish people, which for some people at least is complicated by where they live. Things like poor transport, crime or the fear of crime, and having nobody to visit them or encourage them and coax them to get out and about. They're real issues contributing to social isolation for Irish people. And social isolation is a serious risk factor for dementia. It's also probable that lifestyle factors play a part. Things like smoking, obesity, and poor diet are all known factors contributing to the risk of dementia. And for at least a small part of our community, excessive consumption or long-term consumption of alcohol is another risk factor. But apart from the risk, what else is different? When most people get dementia, they lose their ability to retrieve recent memories. Although they have short-term memory loss, they can often recall memories of earlier periods in their lives. But because for Irish people, their early life was in Ireland, their experiences will be very different to their neighbours, to their English neighbours. When the recent memory fails for Irish people, they may vividly recall their childhood in Ireland. They may recall leaving home, they may recall working or raising their families in England. They may not remember to eat their breakfast, but they will be able to recite the poems that they learnt at school. Some people from Gaeltacht, that is Irish-speaking areas, may lose their ability to speak in English, although they have managed quite successfully for many decades. Those people then have to rely on their mother tongue, which is Irish, which is not understood by many people. These cultural factors all have implications for the families who are looking after people with dementia, also for services like luncheon clubs or day centres that potentially Irish people could attend. In most local authorities, there are clubs and day services for people with dementia. And although their neighbours may enjoy a local memory cafe, Irish people often feel excluded because people are talking about a local history which they may not feel part of. Music is known to be very powerful in stimulating and evoking memories and is generally enjoyed by people with dementia everywhere. Irish people may know the words of Roll Out the Barrel, but it may have little meaning for them in the same way as it is meaningful for English people. What is meaningful for Irish people are the songs or the poems that they learnt at school. I have worked with people who rarely spoke because of their dementia, but when given a prompt could recite the poem The Old Woman of the Roads word for word. Similarly, if somebody sings or plays the introduction to an Irish song, they can break into song and sing it verse for verse. Although we shouldn't generalise, our experience in Irish in Britain shows that Irish people enjoy mixing with other Irish people. And this becomes even more important when Irish people get dementia. Dementia can be very frightening. It makes people feel anxious and on high alert, although they may not be able to express that. When memory fails, feelings become far more important. Therefore, hearing Irish accents, being with people who understand Irish accents, who can pronounce Irish names and know which county is which, makes it much less stressful for Irish people with dementia. In addition, Irish people who met hostility when they first came to England, or who experience discrimination in the NHS, by the police or in public services, will feel on edge in non-Irish environments. So, although we look the same as our English neighbours, and most of us speak the same language, and we have lived here for several decades, our differences become far more marked when we get dementia. Recollections of our early life in Ireland, our experience of migration, making a home in a new country, have populated our memory bookcase. While we face many of the same barriers as other people with dementia, our heightened risk and our specific cultural experience justifies resources, services and support which are culturally sensitive for Irish people with dementia and their carers. Thank you.